Hello everyone and welcome to our channel. During the peak season for influenza, many people go to the hospital because of fever and cough. Quite unexpectedly, during a chest imaging exam, they come across an unfamiliar term, pulmonary nodule. In most cases, it appears without any warning signs and is usually not accompanied by obvious symptoms. However, once people learn that there is something in their lungs, their minds often immediately jump to the worst-case scenario. Many begin to ask themselves repeatedly, do I have lung cancer? Will it suddenly grow bigger? Could it spread? Anxiety quickly doubles, and some people feel compelled to undergo repeat CT scans every few days. Others choose an avoidance strategy. Since they feel no discomfort and have no symptoms, they simply pretend it does not exist and stop follow-up altogether. Still others develop a strong urge for immediate treatment, believing that only by removing the nodule right away can they finally feel at peace. So, are pulmonary nodules really that frightening? And what should you do after discovering one? Medically speaking, a pulmonary nodule refers to a round or irregular shadow in the lung with a diameter of 3 centimeters or less. It can be single or multiple, with either well-defined or blurred margins. Simply put, it is like a small lump growing inside the lung. The vast majority are discovered incidentally during routine physical examinations. They do not hurt, do not itch, and give no active signal of their presence. Most pulmonary nodules are benign. For example, granulomas are among the most common benign nodules. They are often scars left behind after previous infections with certain bacteria or fungi, such as tuberculosis or histoplasmosis. These are like entries in the body's old account book, only rediscovered incidentally through imaging. Some nodules are rheumatoid nodules seen in patients with rheumatoid arthritis. Others represent localized inflammation caused by acute or subacute infections, and as the infection resolves, these nodules may gradually disappear. Of course, from a medical standpoint, malignant pulmonary nodules must also be taken seriously. These may include primary lung cancer or metastatic lesions from cancers in other organs that have spread to the lungs. This raises a critical question. How do doctors determine whether a nodule is benign or malignant? This is the core challenge of pulmonary nodule management and requires a meticulous and systematic medical evaluation. To help clinicians make standardized judgments, several authoritative guidelines have been developed, including those from the American College of Chest Physicians, ACCP, the Fleischner Society, and the widely used NCCN guidelines in the oncology field. In addition, the lung cancer screening field uses a classification system known as lung-RADS to stratify the risk of nodules and guide decisions regarding follow-up or further testing. On imaging, pulmonary nodules are generally divided into 3 categories: solid nodules, ground glass opacity nodules, GGO, and part-solid nodules that fall between the two. These different types vary in their imaging appearance, probability of malignancy, and follow-up strategies. Therefore, when developing a management plan, it is crucial to understand not only the size, density, and shape of the nodule, but also patient-specific risk factors such as smoking history and family history. Taking the NCCN guidelines as an example, if a solid nodule is smaller than 4 millimeters in diameter and the patient is considered low risk, no special follow-up is usually required. For solid nodules measuring 6 to 8 millimeters, follow-up imaging is recommended at 6 to 12 months. If the nodule remains stable, another follow-up is suggested at 18 to 24 months. For larger or more suspicious ground glass or part-solid nodules, more aggressive evaluation is needed, which may include Peru time/central time, needle biopsy, or even surgical resection. Therefore, when you are faced with a pulmonary nodule, please remember 3 very important points. First, the majority of pulmonary nodules are benign, and there is absolutely no need for excessive panic. Anxiety only adds to psychological burden and does not change the nature of the nodule itself. Second, be sure to follow up on time. This is not overdoing it, but rather a long-term, scientific management approach that helps doctors determine whether the nodule remains stable or is changing. Third, place your trust in professional physicians. Radiologists, thoracic surgeons, and pulmonologists all undergo rigorous training and are able to provide the most appropriate recommendations based on imaging features, risk factors, and established guidelines. In addition to medical evaluation, a healthy lifestyle is also an essential part of lung health management. If you smoke, quitting is the most direct and effective action you can take to protect your lungs. Avoiding secondhand smoke, reducing exposure to air pollution, and engaging in regular physical activity, such as brisk walking or swimming, can all help strengthen lung function. Consuming foods rich in antioxidants, such as dark green vegetables, nuts, and blueberries, can also continuously support lung health in everyday life. Finally, please remember that a pulmonary nodule is not a verdict of disease. It is more like a warning light from the body, reminding us to reassess our lifestyle habits, to pay closer attention to lung health, and to maintain active communication with our doctors. If you found today's content helpful, please like the video, subscribe to our channel, and turn on the notification bell. Thank you for watching, and we'll see you next time.